Hi there, Duncan here, and welcome to Life is Movement for another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of these exercises valuable, you're of course welcome to use them as you see fit. Just please make sure you do so safely. Today I want to talk about simple hanging from a bar. A simple exercise, but can yield really good results. Now, I tend to offer this to patients who have issues with their shoulder in the sort of mid to later stage rehab. And I do believe that that's, from my understanding of the research, that's where the most evidence lies in terms of the efficacy of this exercise. I know that some people do advocate for it for issues of the lower back to get a little bit of spinal decompression or spinal traction. I personally find it does help a little bit if my lower back's a bit tight to just hang from a bar for a while. However, my understanding is that the evidence base in terms of using it for that reason isn't quite as strong. So, just to get an understanding of the potential efficacy of this exercise. But for the shoulders, certainly there's strong evidence that this can be a valuable exercise. So, how do you do it? Well, you hang from a bar. Nice and simple, which is one of the reasons I like it. Now, if you're not used to doing a lot of pull-ups and things like that, particularly if you're a full-grown adult and you haven't done monkey bars in a while, hanging from a bar can actually be surprisingly challenging in the early stages. So what I advocate for is when you start, what you do is you just hang from a bar, but as you can see, my toes are still on the floor. Thankfully, I'm a little bit taller than average, so thankfully this is a nice high bar so I can fully extend. But as you can see, what I'm doing right now is I'm putting a bit of weight into my hands, but I'm also keeping a fair amount of weight into my toes or into my feet. It kind of feels like about a 50-50 split at the moment. But then what I can do is I can start putting more and more weight into the hands and less into the toes. And then maybe I lose a toe, maybe I lose a foot, so I'm only putting it into one foot until I eventually am just hanging fully with my entire body weight into my hands. And that's basically how we hang from a bar. What I try to do is make sure I'm at full extension. As you can see, my arms are fully extended. I'm not sort of like bending the elbows or anything like that. And then all you do is hang for a few seconds, 5 seconds, 10 seconds, and then rest. And you can repeat that process as you see fit. Now, if you read the research on this exercise, there is some evidence that advocates for fairly substantial lengths of hanging in order to get benefit. There's one shoulder study that got a lot of traction. I think they recommended 5 minutes of total hanging. That's obviously quite a lot. I don't know too many people who can just hang from bar for 5 minutes straight without falling off. I know I certainly can't. I weigh about 100 kilos, quite heavy. However, it doesn't have to be perfect to get some benefits. So I would say, see if you can hang for 5 seconds and then practice that for a few days and then see if you can hang for 6 seconds and then build it up like that. I personally use a protocol of before my workouts or sometimes after my workouts. I try and hang for about 60 seconds. And I find if I do that, it has a real opening up effect of my shoulder joints. And particularly my right shoulder where I've had some sort of degenerative changes, some arthritic issues. This exercise has really helped me be able to maintain the functionality and strength of my shoulder while I still continue to lift weights and do jiu-jitsu and wrestling and things like that. So simple exercise, but it can be really effective. Try that and see if you get some benefit. Good luck.